Hi everybody, it's Jared O'D here at Dynamis, and I'm just packing up after an amazing week and a bit actually, of training here at an addictions treatment center in Dubai. The call to prayer just finished. There's a mosque just a couple hundred yards away, so I had to wait until that was finished before recording this quick video for you. It's a small clinic, 17 beds here, just getting started, and so they don't have a lot of space inside the building, so they've given us this fantastic rooftop space to do the training in this week. You may have seen some of the pictures. Right behind this glass partition is a swimming pool, which the patients who come here for treatment will be able to use as part of their treatment plan. There's a gym in the building, beautiful rooms. The whole thing's been risk assessed really well, and there's some fantastic staff here. I met some of the doctors who will be looking after the patients here this week, and they're top class. You know, we had a master class from some of them about the different verbal de-escalation strategies that we should use when our patients are doing various things, like, as we saw, they may have communication difficulties. There are cultural clashes that happen in this environment. There will be moments, we looked at the scenarios during the week, there'll be moments where the patients don't want to follow the regime that's been planned out for them. There'll be moments where they want to do things that are not allowed. They may want to smoke a cigarette whenever they want. They may want to eat and get food deliveries whenever they want. They might even not want to take the medications that are part of their treatment plan. So we looked at a lot of verbal non-escalation and de-escalation strategies for those particular moments. Moving through the scenarios, we looked at delirium. Part of detoxification from narcotics abuse and so on will be that some psychological states might become prevalent, so we might see somebody who's delusional, delirium, so a very short-term psychosis type thing. And the fifth scenario we looked at was self-harm. Look at the helicopters going past here. Self-harming behaviors and some very physical violence, let's say, that might happen when somebody's in that state. So I'm going to put away my focus mitts. We use those, as you may have seen, to simulate different types of assault, different types of behavior that might happen. And we've been using those this week to make sure that there's the proper amount of intensity in the training. We even use them to simulate thrown objects in the environment. You'll see here we've got a little bit of matted area. We have been looking at what the staff should do when they work as a team to cope with some high-risk behavior, high-risk assaultive behavior, let's say, that might result in a floor control, floor stabilization. And the team worked on some excellent teamwork and tactics to cope with that sort of situation. Just yesterday we worked on this poster, which is a summary of the risks of sudden death proximal to restraint, and that was really important for the staff to know. So a lot of staff don't know that until they've had training. And in this environment, we had one or two nurses here who have worked across the Middle East in psychiatric care and in mental health care, and they hadn't yet had an introduction to the risks of sudden death when we restrain somebody. Quite prevalent in this area to use mechanical restraints, for example, and chemical restraints. In this environment in particular, they're trying not to do those things, and so they have a seclusion room, for example. So that was an interesting moment when we talked about that. So last poster I'm taking down. This is our use of force rules poster, and I should probably say that in the UAE, there are a couple of companies delivering conflict management, personal safety, and physical interventions training, but I think we've been doing it longer than most of them. And also, we have incorporated UAE penal code and labor law into our training quite extensively. When you look at the HSE reports, UK Health and Safety Executive reports on violence management training for healthcare, one of the things they say is that it's very important for staff to understand that that they're working in a supportive environment in relation to their own personal safety, a supportive environment in relation to perhaps restraining a patient. And so for us, it was, and it always has been, really important to do the research and to understand the legal environment in which the staff work. And they've always found that really, really helpful, and it's something that's generally absent from other firms who come out here from the UK or from the US to deliver the training. So I'm going to roll up my posters here in a minute and get things ready to go. So we've had a really good time. It's probably a lot longer video than I thought I would make. I'm testing out some new tech that's helping me to do this. We've had a fantastic couple of weeks. It's been 2 full weeks training here. And hi, all right. We're just about getting ready to wrap this up, and I'm sure we'll be back soon doing work here in the schools. We have a lot of supporters in the international school network here, and we're hoping to expand our work in the healthcare sector yet again, and that will be a good result. The weather this time of year in the UAE is fantastic, but I need to be careful that I don't end up with a sunburn. I hope you've enjoyed this video, and I hope you're having a good Friday wherever you are. We'll talk to you again soon.